I'd like to read the resolution. Whereas peripheral artery disease, PAD, represents a critical public health emergency affecting millions of Americans, with Georgia being a region of particular concern due to high rates of risk factors such as diabetes and obesity. And whereas PAD is a significant health burden, approximately 21 million Americans currently are suffering from this condition, according to the most current epidemiology study data. And whereas the American Diabetes Association reports that 85% of PAD related symptoms are preventable, highlighting the urgent need for early detection and intervention. And whereas Georgia ranks among the top 20 states with the highest diabetes prevalence, with 12.7% of adults living with diabetes and approximately 35% living with obesity, both primarily precursors to the devastating complications of PAD. And whereas research shows significant racial and ethnic disparities in PAD diagnosis and treatment, with Black and Hispanic patients experiencing disproportionately higher rates of amputation covered by compared to white patients. Really, it's 2.2 times higher in Black patients and 1.36 higher for Hispanic patients. And whereas major amputation costs approximately 13.4 billion in annual direct medical costs alone. I should say that again. It's $13.4 billion annually in direct medical costs, with Medicare and Medicaid covering almost 80% of these expenses, representing a substantial economic burden to the taxpayers. And whereas studies indicate that 70% of PAD patients have not received a pulse examination from their primary care provider, despite presenting symptoms such as leg pain, leg cramps, neuropathy, numbness, and non healing lower extremity wounds. And whereas early detection of PAD can reduce the substantial risk of subsequent cardiovascular events, with 1 in 5 undiagnosed patients likely to suffer a heart attack, stroke, or death within 5 years. Now, therefore, be it resolved that September 2025 is recognized as Peripheral Artery Disease Awareness Month in partnership with the Global PAD Association. And whereas this resolution is adopted, will be adopted again in January in the House of Representatives. But today I am honored to present a resolution recognizing September 2025 as Peripheral Artery Disease Awareness Month.